Time now for Real Men Wear Gowns. It's our campaign to get guys to put on the hospital gown, get that scan, that test, be proactive with your health. This week we're focusing on respiratory health, and we let you decide what to ask the doctor. Carol wants to know, she's been told many times that because we live in Indiana, it's normal to have nodules in our lungs. She would like to know more about that.
So nodules by definition is a growth on the lung that is less than 3 centimeters, so about a size of a quarter or less. And it could be benign. The nodules can be malignant. So on a CT scan or an X-ray, it'll just look like a growth. Now, coming to the point of they're common in Indiana, yes, they're common in Midwest. The most common cause is fortunately not malignant. Even in smokers, the most common cause is a fungus that is very prevalent here in Midwestern states called Histoplasmosis. It's endemic to the dust. You're more exposed to it if you're in construction work or have certain pets at home. Not that you need to get rid of them, but as we inhale those fungal spores, they go down in the lung, randomly distribute. Our immune system contains it, kills them. Sometimes, majority of the time, people don't even have symptoms. And in the process of containing that infection, it leaves a scar on the lung that can look like a nodule. So the key is, from a medical standpoint, to ascertain whether these nodules are benign or they could be potentially malignant. Now, the histoplasmosis related nodules do not turn malignant. But if someone is a smoker and has 3 nodules, how do you know which one is malignant, which one is not, or are they all benign, or are there 1 or 2 are malignant? So that is where you see the pulmonologist, and it's their job to figure that out.
And that type of thing would be detected, those nodules, with a CT scan?
Yeah, I mean, sometimes, majority of the time, they'll be picked up randomly on an X-ray done for whatever reason, or CT scan done for any other indication. We're seeing more of these now in the smoking population because lung cancer screening is an accepted modality, and as those patients go for a screening scan, sometimes you see a nodule, and then that's the question whether that's a malignant or a benign nodule.
And we also talked about pneumonia, COPD, chronic coughing. You can catch the whole conversation online at WTHR.com/realmenweargowns. Thanks to Dr. Faisal Khan for coming back and talking with us. All right, to the weather now, and another